So let's get started with our first talk on ACT, psychedelics, and behavior change from Henry Whitfield. So Henry is a visiting research fellow at Regent School of Psychology and Psychotherapy, investigating the process of psychedelic behavior change with high-density, longitudinal data using ACT-consistent interventions. He is a highly experienced psychological therapist and supervisor, having trained mental health professionals in acceptance and commitment therapy for 14 years. Henry is also an ACBS peer-reviewed ACT trainer, senior traumatic incident reduction trainer, and therapist with many years of experience working with trauma. You can learn more about his work at www.psychflex.co.uk. So, Henry, whenever you're ready, we'll just get started. I'm really excited about this one and really excited about the day in general. So let's just get going whenever you're ready to go.
Okay, well, thank you, Niall. Thanks so much for inviting me to come and present at the Weekend University. Seems like you've got a great little setup here with the kind of stuff that you're offering. So yeah, here we are. I thought, I've never presented through this platform before, and I'm really curious to try out a little poll. So I thought I might just start with a little question, see if this works. I'm just curious to see how many of you out there might have actually experienced a psychedelic, because they are quite something to experience. Today, of course, we're going to be talking quite a lot about what you might have. Hopefully today will give you a good sense of what a psychedelic therapy might actually be like. So wow, see plenty of the answers pouring in. So quite a few of you have, at the moment about 30% of you have. Great. So I believe you can already all see my screen. So I guess I'd better just get on with it. So yeah, first of all, I'd like to acknowledge that part of what I'm going to be presenting today, it is as well as some general background information about psychedelics and psychedelic assisted therapy. We're going to be looking at some research that we've been doing at Regent's University. So I've had so many people help make that happen. So I would really like to acknowledge them. Maria Luca, I guess I don't really have time to read out everybody's name, but there are so many people that have helped make this happen. So thank you to all of you. So now, see if I can get this to work. I might be on. Okay, so just a little overview about what we're going to talk about. So yeah, the topic of today's whole day really is behavior change, scientific behavior change. So I'm going to be looking at how might there be some kind of interface between psychedelics and how we change what we do. So we'll be touching on some of the recent psychedelic research. I guess one of the main things I'm hoping that you're going to get from today is a sense of what it's of psychedelic assisted therapy cases. What is it like to go through a change that's assisted with psychedelics? We're going to be looking at a new psychological flexibility model, acceptance and commitment therapy, which is a therapy that to come out of contextual behavioral science. Has a lot to do with a big emphasis of it is psychological flexibility. How do we think more flexibly in order to behave more flexibly, both inwardly and outwardly? So yeah, like I already mentioned, we're going to be looking at some examples of psychedelic assisted behavior change. As we're going to be looking at it from the point of view of behavior change and contextual behavioral science, we're going to be looking also at what actually reinforces change. Because it's one thing to, especially with psychedelics, it's one thing to start engaging and to start perhaps seeing the world differently, behaving a bit differently. But then to sustain it is another thing, and it's something that's fairly universally recognized in psychedelic assisted therapy, that some of the changes might not necessarily come that easily. It does take, yeah, in plant medicine circles, I'm sure some of you, perhaps some of you who answered yes to the poll, will be aware that in plant medicine circles, there are people say things like, you have to meet the medicine. Medicine's the word used to refer to, you know, the psychedelic substance that you're taking in order to heal, in order to grow psychologically or spiritually. You have to meet the medicine halfway. It's not just, it's very, it's really not like taking a paracetamol or certain drugs where you just take it and then you're a patient who just sits there and it has the effect on you. It's very different to that. Just like any behavior change therapy, it's a very active process. You have to commit, you have to intend change in your life. And then, yeah, at the very end, we'll probably just briefly touch on how psychedelics might be interesting for looking at human evolution or cultural change, human potential. So I'm just going to briefly give you an overview of what psychedelics are. I'm sure quite a lot of you have a good idea, but probably not all of you. So I really like what the word psychedelic actually means. I think it's derived from Greek, from the Greek. I'm sure many of you already know that psyche is the spirit or mind. And the word the root of the second half of the word delic comes from revealing. So, and this overlaps very well with mindfulness. In mindfulness, we talk a lot about how the mind is like a lens. And so right now, as you listen to me, you're listening to me through a certain lens. Even your ears are a certain lens. Your mind, how you hear the words that I'm saying, you might be having judgmental thoughts about them. You might be having, oh yeah, I like that idea, I'm familiar with that idea. Everything you're hearing is through a lens. So what psychedelics do is they enable us to change that lens so that we see a different view. And that's, of course, very much what we do in mindfulness as well. Being aware that the mind is like a lens, and that if we are aware of this, more aware of this lens, if we can tune into it, then the effect of that lens is different. We might see things from a different perspective. So just anthropologically, I'm touching on a few different aspects of psychedelics here, anthropologically, psychologically, and chemically even. So yeah, another thing is they've been used all over the world for a very, very long time. Perhaps almost as old as humans are. This is a Siberian shaman. In Siberia, I know that psychedelic mushrooms have been used in Siberia, but every continent has, I'm not sure about Antarctica, but certainly I think just about every continent has used, we know for certain that psychedelics have been used in a ceremonial context for a really long time. Getting together these plant medicine traditions like ayahuasca, some of you will have heard of ayahuasca, which is a healing ceremony from South America. Down here at the bottom, we have a little picture we'll probably have a closer look at later. An ayahuasca brew, the active ingredient is DMT. But continuing to move through history, a little bit more recently, actually a book came out very recently all about how in Greece, perhaps even around before and around the time of the rise of Christianity, it's likely that psychedelic ceremonies were used. There's a whole book that's just come out about this called The Immortality Key. And some of you, I'm sure, have heard of Aldous Huxley's famous book in the 1950s. And then more, what I haven't added to this slide, but perhaps I should have, is over the last couple of decades, there's been a resurgence of psychedelic research. So there was a huge amount of it done in the 1960s, 1950s, 1960s. Then, unfortunately, it became illegal, and so not much happened for quite a while, where it had to go underground. But as of I think the 90s, and especially in the last maybe 15 years, there's been a lot of research happening. So just looking at it chemically, I think they're quite interesting too, psychedelics. This, if you look at this hexagon and this pentagon, this alone, this isn't necessarily a psychedelic. This is just on the biochemical side of things. I like to think of this like a little key that fits in a lock, or I think, biochemically it can be interesting to see molecules like little pieces of Lego that plug into each other or that complement each other. And so, yes, maybe, another thing I could drop in is, the psychedelic substances disrupt how the brain processes information. And something called, and there's many different ways that this can be done. And the most classic psychedelics, the psychedelics that are being researched the most, as far as I'm aware, are what we call serotonergic psychedelics that affect the serotonin system in the brain. So this little picture we have here of the hexagon and the pentagon, it's actually, you find it all over biology. It's actually part of an amino acid. It's one of the essential amino acids that we have to eat, an amino acid called tryptophan. So I love that even biochemists have determined this particular chemical structure to be an interspecies signaling molecule. So even on a biochemical level, this really speaks to ecological principles. That it's even been called an inter-kingdom signaling molecule. So so very, very different species that have, normally you would think they didn't have that much to do with each other, but of course in an ecology, different parts of the ecology are dependent on each other and talk to each other. So over here we've got three very well-known psychedelics. We've got, of course, magic mushrooms. You see the same indole structure. Got mescaline from the cactus. And we've got LSD, which is derived from a fungus, which again has this same structure. There are psychedelics that access completely different parts of the brain and don't have this, where it still disrupts how we interact with the world, how we perceive the world. Down there on the bottom right, we've got DMT as well from ayahuasca that I was mentioning earlier, a brew made from two ingredients. So that just gives you an overview, hopefully, of what a psychedelic alone might look like. Just starting to touch on some of the research points. We've got, of course, safety is really important. I think it's important to emphasize that psychedelics definitely aren't for everybody, because they bring up very, very strong, they can bring up very, very strong, intense emotions and even the deepest fears. So if someone was very suicidal, for example, then maybe that could be not the best option for that person in that moment. But as more and more research is done, the therapist in me and the researcher in me, the optimist in me, hopes that even people who are in a very challenging, difficult situation psychologically, that they will, perhaps psychedelics could help them too. It's just that I think they will need a lot more support. But on a chemical level, they're very, very safe. Professor Nutt, he's famous for his research into how harmful different drugs are, and psilocybin, magic mushrooms came out, I believe, as the most safe or the least harmful in a study that he was doing. I believe alcohol was the most harmful. Of course, it's, how we assess risks and harm is quite a complicated thing, but it's good to know that they're anti-addictive and they don't cause any physical harm. Because if a person was in a very vulnerable state, it's possible you could be traumatized. But of course, in life generally, when a person is in a vulnerable situation, we can get traumatized. It's not like it's some kind of substance that physically damages you, which is something that I think people have feared about psychedelics. So now we're going to start to touch on combining psychedelics with mindfulness. I've just got a couple of images here from a study, I believe it was done at Johns Hopkins University from Roland Griffiths and colleagues. And I just like this, I like this image over here because I think it sums up visually what seems to be happening when we combine mindfulness-informed practices with psychedelics. So I don't know, yeah, you probably can't read, sorry if you can't read this, but what it says in this very small print here, it says low dose standard support. So the standard support refers to support in building a spiritual practice using practices like mindfulness meditation. So what you can see, and in the study they measured many different things. This is just one of their tables from the paper that they published in 2018. You can see the difference between the red bar and the light blue bar. That's the difference when a higher dose of, I believe it was psilocybin, was added to the mix of the same spiritual practice. So you can see that the psychedelic seems to function like almost like a mindfulness turbo booster, or makes the person more present. So if you're engaging in something like mindfulness meditation, you seem to be able to engage with it to a deeper degree. So and then the dark blue one is just with given higher support. The main thing I just wanted to highlight is that there is a special synergy. It does seem to be a special synergy between mindfulness and psychedelics. Then, yeah, on a neurobiology level, there's something that came out just early last year from, I think, the Maastricht lab, Kim Kuiper's lab, where, yeah, just to summarize briefly, findings show that mindfulness meditation and psilocybin exert similar effects on mood, social skills, and neuroplasticity. It's even possible to measure with brain scans and things how a person's brain changes just with meditating, and we can compare that to how a person's brain changes when they take psychedelics. So yeah, and that was done in the context of mindfulness and depression with psilocybin. There's also kind of big effect sizes. Another thing that really stands out about the research is there's very large effect sizes. I think on, is it maybe my next slide? Yeah, was a meta-analysis done also very recently. The amount of, I think the lockdowns helped with a flood of psychedelic papers emerging. Although that was, yeah, I don't know exactly when that came up, again in 2020, a meta-analysis is done where it was, what seemed to be coming out of the data was that the effect size of a psychedelic added to some kind of psychotherapy was larger than generally than other studies where it was either just a psychedelic or just a pharmacological intervention or just psychotherapy. So again, it's like the combination of the two. It's like, I'm hesitant to say maybe it could even be like greater than the sum of the parts, but certainly it's certainly additional. Just having two forces that serve your psychotherapeutic growth that work in tandem, in harmony with each other, does seem to carry you to a new level of psychological flexibility, a new level of possibility, perhaps even. That's the kind of thing that we've been investigating in the psychedelic research at Regents, where we've been looking in detail at how the individual cases change during psychedelic therapy. So yeah, this emerging alignment, behavioral variation. I kind of mentioned behavioral variation because in contextual behavioral science, which we are about to hear a little bit more about, we like to look at things from an evolutionary point of view, and I think you're going to be hearing a lot more about that from David Sloan Wilson next. But yeah, another way of understanding how psychedelics and many psychotherapies help is that we need to vary. If we try out new things, we can learn new things and find out how we can operate differently, perhaps in ways that serve us better. But yeah, contextual behavioral science, how does that fit into the mix of psychedelics? Well, first of all, I just want to tell you a little bit more about contextual behavioral science. I was just touching on that. CBS, or contextual behavioral science, interweaves behavioral science with a multi-level evolutionary science for practical research in many areas: clinical psychology, organizational psychology, cultural change. It's a very pragmatic approach. We often talk about the official term of the philosophical position is functional contextualism, which sounds like a bit of a wordy mouthful, but that's basically all about how it's a pragmatic approach. So in other words, we're not looking for a universal truth, or in fact, generally we see language as a tool that can serve us or not serve us. And it's very easy for us, for example, in things like acceptance and commitment therapy, we're always looking at what our relationship with the words in our heads is like. Are we taking our thoughts literally, or are we seeing them as just information, thoughts that may or may not be useful? The contextual part is we're always aware of whenever we have a thought, we're aware of when do I have such a thought? And we're also aware of where does that thought take me? So it's like a before and an after. We're getting the broader context of things. Because, in life, it's so easy to just take things at face value or not see the bigger picture. So this contextual side of it is stepping back and having a sense of the bigger picture. So yeah, in acceptance and commitment therapy, the way I see it, it's a more bespoke, precision application of mindful behavior change. It's precision mindfulness. It can be mindfulness without a meditation as well. Yes, there's quite a lot of people who don't get around to meditating or don't connect with meditating for whatever reason. So yeah, also acceptance and commitment therapy, it's best known in the clinical psychology world, I guess, although it's used in organizational change as well. But acceptance and commitment therapy it was developed by the Association of Contextual Behavioral Science. Yeah, it's been around for quite a while now. I think the first book on it came out in 1999, although it was definitely around before then too. So yeah, already connecting this with the psychedelic world, I know at least 3 or 4 universities have been involved in studies using acceptance and commitment therapy in a psychedelic therapy context. So yeah, we were just looking in the previous slide about how there seems to be this natural synergy between mindfulness and psychedelics. So kind of the way I understand psychedelics and acceptance and commitment therapy, or psychedelics and contextual behavioral science, is hopefully it's an even more precise, dynamic, responsive, bespoke application of that. So that's kind of how I think of it. So yeah, just going to give you a little bit more of an overview of acceptance and commitment therapy. So yeah, and the word that stands out to me on this slide are the word slow down. That's a good reminder for myself too. Here I am giving this presentation. I've got all these slides and part of me wants to rush. Like, oh, am I going to get through all my slides on time? And when we go into a kind of rushing way of being, very often that's when we're being less present. So here, as you can see, hopefully on this slide, one of the first mindfulness processes is if we divide this into mindfulness and acceptance processes, mixed with commitment and behavior change processes. So slow down is a bit of an antidote when a person is being not so present, because there's stuff in your head saying, you've got to do this, do this, do this, do this. So often when you are rushing, you're probably in an automatic pattern. So yeah, I think it's another useful concept within mindfulness. We want to break patterns. Yeah, I think some approaches even often use the term pattern breaking. Behavior change is to do with pattern breaking, which is a nice succinct way of highlighting that we have patterns and we're stuck in our patterns. If we slow down, we might notice our patterns and be able to step out of them. So So then that brings us to the next mindfulness process, acceptance. Again, on a more down to earth, less something that feels less like some kind of academic terminology. Just allowing your inner experience to be there. So again, it's useful for me to apply this to myself right now. If I feel rushed and I've got to get through lots of slides, I can just allow that feeling to be there, not necessarily have to act on it. Or yeah, the dark side of this, or the opposite to this, which I've often indicated in red here, is it's like, I didn't need to do that. Fighting the quicksand. If you fight quicksand, of course, you get stuck in it even more. So if I go along with my temptation to rush as I give you this presentation, then yeah, I'll probably feel the sense of rushing is probably not going to help that much, and I'll probably be less and less present. I'll be trying to make if I have a fear of not getting through all my slides on time, by trying to make that fear go away, that might not be the best way of conducting my presentation. That next brings us to diffusion. How are we doing for time? I'm doing fine for time. Yeah, I noticed we have a chat here. So I haven't been reading the chat, but I should probably focus on my. Oh, hi, Katie. Nice to see you again, or read you again. So yeah, diffusion is stepping back from thinking. So there's another big aspect of mindfulness and acceptance and commitment therapy is what I'd like to use the word transcendent. To transcend something, I think, means to step back for a minute and see that broader context and not take it so seriously. In fact, another little poll I'd like to run is I'd be really curious to know how many of you are therapists. So yeah, when we diffuse from something, one of the simplest ways of diffusing that I like as an acceptance and commitment therapy therapist, just to notice how old thoughts. Remember this idea of noticing patterns. You know, certainly the thoughts that we have, we assume they are this fresh, new appraisal of the present moment or something that's really appropriate. But then if you just ask yourself, how old is that thought? Then very often the answer is something like 20 years. That's the next poll. That's what goes. So yeah, just noticing how old a thought is. Another very simple example of diffusion is to simply repeat a thought that you have. If you take it very seriously, if you repeat it a number of times, that can also kind of jiggle it loose so that you don't. So, are you a therapist? A lot of you are. I thought you might be. 63%. So that brings us to the self. Now, in my opinion, I think the self, this process for the self, often referred to as self as context, which again is a kind of stepping back self, not a self that believes it's a particular thing. So maybe the dark side of this, or a flag for this one, is when you might say to yourself, or hear somebody say, "Oh, that's just who I am. I've got this. I'm just this. I'm just that. I'm just an old fireman. I'm a blah blah blah." When you have this particular idea about who you are, that's often can be problematic. So here, this is another metaphor for it, of a chessboard where you are the board, not the pieces. Sorry, you are the board, not the pieces on the board. The pieces on the board are the contents, the stuff of your mind. So then to sew this up, connecting it to behavior change processes, we want to constantly assess our behavior. So yeah, one of the most central principles in all of ACT and behavioral sciences, whenever there's a behavior, and whenever someone is doing something, what is reinforced? Why is that happening? So what's the function of it? So more down to earth language, what's motivating that behavior? What are you kind of hoping might come from that behavior? And secondly, when you engage in that behavior, what actually happens? Because a bit like a grim fairy tale, fairly often what actually happens is different to what you were hoping would happen. Then finding values, we spend a lot of time looking at values in order to have a direction to guide our behavior, so we know that we're doing what we want to be doing. So, next slide. So, yeah. So in response to that, and then also because it's been my job, I guess, for a while now to look at how can we apply this kind of contextual behavioral science to a psychedelic context. There are some very specific criteria, I think, that psychedelic therapy asks for or requires us to deal with. One is a very wide-ranging sense of self. You have people go from mystical experiences to very kind of fearful, traumatic experiences, like in any therapy. In the deeper therapies, any very deep therapy, it's very likely you're going to face some kind of traumatic memory or a memory when you felt very, very unhappy. So that such a wide-ranging sense of self can bring confusion. And something that's emerged a lot in contextual behavioral science is looking at things from a self-perspective, looking at different self-perspectives, noticing that a lot of what we do behaviorally, because behavior in radical behaviorism definitely also considers inward behavior. If I think a thought, if I imagine a picture of a pink elephant right now, that's still a behavior, it's still something I'm doing, anything that I'm doing. We're also going to touch on, a bit later, we're going to touch on how we reinforce behavior, because psychedelics do seem to lead to a very large, they do invite broad behavior change. A person can leave a psychedelic retreat feeling like they're almost a different person, or they're certainly they have a new self. Is a word that I've heard more than one person use. Feeling like it's changed who you are, but in a way that's so you feel like you're more able to do what you want to do with your life. So yeah, here we have, this is a model I've been developing where it places self-concepts at the real center of the whole psychological flexibility model. As you saw, it was just one process at the bottom of the previous diagram, the hexagon diagram that we went through. And also, I think what's important, especially in a psychedelic context, is to be kind of trauma aware. Like I was saying, I think in any deeper therapy, it's likely some kind of traumatic material will surface at some point. You don't have to have post-traumatic stress disorder to be traumatized. We're all kind of, I think we're all at least have some degree of trauma, or when I say trauma, I mean an experience that affects how you see yourself and how you see the world. It's happened in your life at some point. So yeah, there's a lot in, I'll zoom in a bit, there's a lot in psychedelic research that points to this kind of thing, from the prevalence of traumatic memories to facing really difficult stuff at one end of the scale, and at the other end of the scale you have mystical experiences, experiences of unity, where you feel like you've really transcended your normal human self and you're having a whole other experience of existence, which connects with religious traditions and spiritual traditions. And then in the middle we have this kind of more mindful self, a self as an experiencer. In things like the MDMA research, something that's been used a lot is internal family systems therapy, where you're looking at having a number of different selves. In one of the MDMA for PTSD studies, I think they did something like 67% of the participants, without being prompted to do so, talked about having different selves and like a child self. And of course, very often we have a very critical self that's telling us we're not good enough, or we've got to do better. And sometimes, some of that might be helpful, to push ourselves to do better in life. But of course, sometimes it's more like a dictator that really disempowers us a bit too much. It's a bit too harsh. So anyway, I'm aware that we've been doing I've been doing a lot of talking, kind of a lot of talking at you and throwing a lot of information at you. So I thought we could do something just a little bit experiential to look at these selves. It's just a very simple exercise. Notice these dolls, these Russian dolls are here to kind of remind us that these concentric cells, they are concentric selves. So I think it can be useful to look at things in terms of one self containing another, or one experience containing another. That's another behavioral way of understanding what is transcendence, or what is cognitive diffusion. Like right now, I can take a step back and look at myself giving a talk. Or I can zoom back into, it might serve me more to just focus on what I'm going to say next, rather than thinking about the fact that I'm giving a presentation. That's a more self-conscious example of taking a step back. But very often, taking a step back can be very therapeutic and very, very helpful. So, how are we doing time? Yeah. Yeah, what I'm going to ask you to do, if you're willing to do this, it's just for about 2 minutes. I would like you to just see, if you're willing, if it doesn't feel like it's what you want to do, that's totally fine. But see if you can connect. What do you like when you're most kind of afraid, or in that more when you're in your fear and you're feeling a bit locked up? So you could just answer your questions to yourself silently. In my deepest fear, I might tell myself I might give up or something from my deepest fear, for me personally. Then take another slight step back. When I'm most needy and dependent, so this is more like the child self. When I'm like a childlike self, I might demand others help me, or I might just want to cry. Take another step. When I'm hard on myself, this is a more critical self. When I'm hard on myself, I might tell myself I'm lazy, I just don't try hard enough. Now stepping to that more compassionate, mindful self. When I'm feeling compassionate towards myself, I might tell myself I do lots of things well, and I'm sure I can do lots more things, lots of other things really well if I'm applying myself. Next, take another step back. When I'm most present, when I'm the most present that I know I can be, I might say or think or feel. You can just connect with that more expanded self when I'm most present. What comes up for me is this sense of great potential and possibility of the moment, how each fresh moment has so much that's possible within it. So, yeah, let's just do that one more time silently. So when you're most contracted, what does that feel like? Let's do it from the point of view of feeling this time. When you're most contracted, what does that feel like? When you're feeling more like more dependent child, what does that feel like? Or how do you see the world? When you're really hard on yourself, what might that feel like? How might you see the world in that moment? When you're being compassionate towards yourself, what does that feel like? When you're most present, or most present you've ever experienced yourself be, most engaged, most connected to the present moment, what does that feel like? So feel free to post it. If any of you have anything to share, feel free to share it in the chat. And I just switched. I see all these questions coming through, but we'll probably have to get to those later. It'd be great if any of you have any of your experience to share about that, if it was about what that was like. I guess I am still rushing a little bit. But yeah, in a therapy session, quite often what we're going to look at in some of the examples is often just jumping between two of these, either thoughts of a compassionate self versus thoughts of a critical self. It's a bit like doing a psychological flexibility of self-perspective exercise, almost like a self-perspective press up, jumping, so being critical, being compassionate, being critical. It's a way of kind of stretching that muscle. If we use a metaphor of things being blocked, patterns which are rigid in our minds, with such an exercise like that, I do think we can loosen it. So soon we'll be coming to the end of this first section. But I'm just going to give you an overview before we do that of what is psychedelic therapy. And then I'm going to start looking at some case studies after the break. So one thing to be aware of in psychedelic therapy is it definitely has 3 phases. It has a phase of preparation. So during the preparation phase, you're going to be thinking about your intentions. From applying this kind of model, you might be thinking, another thing that's always found so useful in acceptance and commitment therapy is just noticing, remember this behavioral analysis part of it, or just being aware of why am I behaving the way I'm behaving. So very often we can subtly avoid things. We human beings are very good at avoiding what we don't want to feel. And the way we do that can be very subtle. So you might, in the retreats that we've been running in Holland, where we kind of have been applying acceptance and commitment therapy to in a psychedelic context and for research purposes, really. You might look at how you might look at shame even. Shame often points to that. If we think of the spectrum of selves, shame is the thing when you think when you feel most blocked. Many people, of course, it's not that we're all going around feeling ashamed all the time necessarily, but we build a story to kind of prove why we don't need to be ashamed, but it's probably still lurking there, and it can still be very, very therapeutic to access that kind of stuff. In preparation, you could look into stuff like that, or generally just meditate, just look into being present, just trusting. And with all these different phases of psychedelic therapy, it's kind of debatable how much you should intervene, or it's just nice music and feeling looked after in an environment that might be enough a lot of the time. Probably not always. In fact, I think we know that that's not always enough, but from a behavioral analytic or contextual behavioral science point of view, we can really look throughout this process how we relate to our experience. So, for example, here during the actual psychedelic experience, so the second phase of the therapy is the actual psychedelic experience, where you'll be with a guide who's there to look after you, basically, and make you feel safe. But within your experience, you might notice that you're trying not to feel something. Another thing is psychedelic therapy is very much a music therapy, which is the tradition of playing music that's designed to hold you, and because it's a great way of creating a particular atmosphere that can communicate a kind of accepting environment. Music can also be used to, there's such a thing as more disruptive music, where if it's more challenging, it can help you connect with what's difficult to connect with. And then the third phase is, of course, integration, where you'll work with a therapist, if it's at least in the kind of studies that have been running, or in plant medicine communities, it's always highlighted that you need to do something to integrate what you've learnt into your life. It's a great time to start doing things like meditation. So just looking at this diagram here, you have this is a period running up to the actual mushroom ceremony, assuming it's mushrooms that you're taking, whichever psychedelic it is. Then this is an increase in psychological flexibility that usually gradually wears off, and often always wears off, it seems, or but then this is a kind of key window period to engage in behavior change. So I'm aware that my time is up for this first section, so I'll in the 5-minute break, let's take a 5-minute break, and I'll have a look at some of your questions in the meantime. So one question I could answer straight away is, if you're a newbie, definitely you're likely to start with a lower dose. And as you, like with any new experience, you want to feel your way into it gradually. But what I'm going to present to you now is, yeah, an example of psychedelic therapy. We have, I'm going to present to you, I think I've got about 3 main case studies that we're going to look at. And this first one is see if we can get my slides to work. Yeah, this is Laura, who's a bit of a perfectionist. She did have experience with psychedelics previously. One of the things she was saying before the retreat was the chattering and rumination never stops, difficult to open myself up to love. There's also, I think another intention was, yeah, the intentions, I want to be more connected with kids and partner, generally to be more present. A little bit more about the integration processes too. So, yeah, so what we've been doing here is collecting data, a lot of data actually. This is daily data where every day someone fills out a questionnaire. So we're measuring psychological flexibility. So we're starting to actually be able to kind of measure this, the psychological flexibility boost that seems to be occasioned by the psychedelic. So in the retreat, it's normal to engage in some kind of mindfulness informed practices as well. And then, first of all, a psychedelic retreat happens, then an ACT intervention, some ACT therapy sessions begin at this point in time. So yeah, and then maybe another thing I'd like to drop in is something that, yeah, terminology I kind of take from Françoise Bourlat's quite recent book, Consciousness Medicine. I doubt, I'm sure people have used it for a very long time. She calls it the return. When you return to the memory of the experience or discuss, it's very normal in an integration therapy context. You're gonna, in the first session, you're probably gonna be asked about what actually happened during your psychedelic experience. And so you're going to be looking into that. And of course, you're going to be, when we get to the behavior change aspect of this, how do the new perspectives, we think again of that self, kind of Russian doll model, spectrum of selves, spectrum of concentric selves, then if you have more present selves or more transcendental views of yourself, what do they tell you about your life? How might you live your life differently? Of course, some big emphasis of ACT and contextual behavioral science is how do you translate inner change to outer change? It's a way to sum up what we're doing in the integration game. Although, so during integration, it's not just focusing on that, because a lot of the perspectives will continue to unfold. They will continue to emerge, new insights over a period of weeks, and especially if you engage in practices for boosting that. So here we just have some details. I'll try not to get caught up in too much of the detail. But first of all, yes. So Laura, she was a mother, and her openness as a parent and ability to love as a parent was kind of boosted immediately after the retreat. But also another thing about a lot of these cases, actually, they happened just before COVID hit. So a lot of the ups and downs here may have been affected by COVID. Yeah, isolation with family meant that, I think down here she says it would have been a nightmare if she hadn't had the retreat as preparation. The retreat was perfect preparation. So some of these big drops here, we can actually see life events interacting with the therapy as well. Which of course, life is an interactive process. So as you go back into the world, you're gonna be dealing with things like your partner or your children or whoever your nearest and dearest are, your work. So one thing that came up quite soon, that was brought up not too long after the retreat, is the feeling emerged, feeling powerless and alone. So again, if we plug that into the concentric selves model, then that's going to be a particular self that is powerless and alone. Sounds a bit like, could be a childlike self, or not that you need to label about whether it was a child or not, but it's a disempowered self. So by connecting with that, and so we did an exercise similar to what we all did. Sorry if I rushed it, I was reading your comments. So you could just imagining or even recalling, connecting with inner experiences of feeling powerless and alone. What's it like to become that? Another thing in any therapy, I think, that you need to think about is what makes any therapeutic experience more experiential. So anything that really connects with feeling. Mindfulness, or sorry, psychedelics help you be more embodied. They help you feel more intensely. It's like it turns up the dial turns up the feeling dial. So again, that's just so helpful for doing therapy. This whole period after, it's a bit like the psychedelic is turbocharged of therapy. If you can find therapeutic processes that fit well with the psychedelic experience, which is namely probably mindfulness compatible therapies. That was a way of connecting with those feelings, and very often people report stuff similar to report experiences during the therapy afterwards to be a continuation of the work that started in the psychedelic ceremony. The same emotions, it's a bit like new thresholds have opened up. The psychological flexibility of the ceremony has, even though it might have worn off, or certainly will wear off at a certain point, it's still accessible in terms of memory. You can return there, you can look at it, you can still see the viewpoints that you had. You're more open to feeling the feelings that you had then, so you can continue doing that work during the therapy. Then another kind of perspective switching exercise, something that came up continuing to do this kind of daily meditation on looking at what was felt, looking at how the mind is trying to control things, how it's trying not to feel things, monitoring on a daily basis what you don't want to feel. Something that came up was you're not worthy of love. This is very, very classic common stuff. I think we all have. I heard Steve Hayes recently say in some kind of promo video on Instagram how the I'm not good enough story is almost universal, he said. That's another thing that becomes more clear. It's kind of more is how often that comes up during with a psychedelic ceremony when people are more opened up. Those kinds of stories are very common. So I think it's great if you can access them, because we all have something a bit like that. So here's the worthy, I'm worthy of love, I'm not worthy of love. So compassionate self viewpoint would be I am worthy of love. So it's cognitive diffusion, but also mixed with perspective shifting, jumping between different perspectives. Which in the data we've collected, people seem to have found that very helpful. This moves me, takes me back to breathing, letting go completely on the retreat. So it's an example of her reconnecting with her retreat experience. And what seems to be, hopefully maybe we can see, we're still analyzing a lot of this data, but what the kind of thing we're hoping to see in these lines is how a person's ability to remain open, even when there is adversity, even when there are difficult feelings. Hopefully that will improve. It's all about developing the ability to remain present in spite of difficulty, in spite of the challenges that life throws at us. So we've got more details of having to deal with kind of home issues. I was just already touching on this. A kind of more abstract version is, you can imagine the thought, whatever, connect with a critical thought experientially, and then connect with a more compassionate version experientially, and just going 1, 2, 1, 2, 1, 2 as a kind of meditation. It's also influenced by my background in trauma work and an approach called traumatic incident reduction. That's this reference here, Gaboli. In that is, also they use cognitive diffusion a lot in that theoretical approach. And so putting it in a dichotomy like that, I think can be very powerful, perhaps because it's bringing in this perspective, you're shifting perspective, moving between different self perspectives. Perhaps that is particularly helpful. So then, yeah, also participants, they were all interviewed. I probably won't go into all the detail here, but yeah, here she's mentioning feedback on jumping from one extreme to the other. That's the exercise I was just describing, finding that particularly helpful. Thinking about things in terms of compassionate and adult or critics, the internal family system style stuff, which I see as an expansion of cognitive, an expansion of self as content, an expansion of self story. But just really noticing that we have, in acceptance and commitment therapy, we often talk about having bus passengers that are telling you where to drive your bus, which is different to where you really want to go. So I think it's really useful to expand that into having a younger, a more younger bus passenger, maybe a critical bus passenger, and of course we can have as many bus passengers as we like. But yeah, again, contextual behavioral science is all about noticing the function of anything that we do, including our inner thoughts and feelings. So why is it this critical voice is really going at me? What's it trying to get? What does it want? So being aware of that helps you transcend it and take a step back from it. One little quote I'll read here, though, is, I can only begin to see how this experience, this is in the final interview after having had 4 therapy sessions, I can only begin to see how this experience has touched my life. Sometimes it feels a bit like an additional sensory organ. This additional sensory organ that potentially changes your perception of every moment. So yeah, she's really capturing, I think, trying to sum up what it's like she got what she hoped for, which was to become more present. There's no way, and the effects of that, of having this extrasensory perception, this extra, I don't mean ESP and like psychic stuff, but having this sensory organ. There's no way how I can see what is going to come of that. So I can see there will be changes. But yeah, on the audio it sounded more impactful, but this is, she was really connecting with her experience of how she relates to every moment differently. So then maybe just a little bit more on looking at this daily data that we've been collecting. So this green line is like committed action. So we can look at when committed action increases, is it followed by openness increasing? It's the kind of stuff that we're collecting in data like this. This line here is a daily measure of self as content, or personality getting in the way is the way we, it was taken from a measure for measuring different senses of self. My personality gets in the way of making my life better, as an example about the question that this one is measuring on a daily basis. So I think what we found very much is that these two negatively correlate. As the personality gets in the way, the person gets less open. That openness to feelings and sensations decreases. And from these we can build up these, I'm indebted to Brandon Samford at the University of Nevada, Reno, for helping process this data so we can start to find relationships. And something that we found, this one here is just for this one individual, but we can zoom out to looking at group effects. And something that was more than 75% of the participants actually, we've measured this on 16 participants so far, where we had enough data points. So we need about 60 data points per person. So nearly 1,000 data points. This pathway of going from progressing to being more aware, red arrow normally means negatively correlates, but I know that the general pattern is when you take action, so the behaviorists will like this, it seems to start with taking action. When you make progress or do something towards what you care about, your acting with awareness will increase. You're more aware of what you're doing, which can lead to your openness increasing. As your openness increases, you're more able to feel negative emotions, and that can lead to being more aware of your personality. As more negative emotions, I think it jumps to see, as you can see, it's quite complicated. There's different routes here, but I think the generic one that most people engaged in was you became more aware of your personality getting in the way. So that's kind of an overview of that first case. So just going to touch on some other. We're going to look at two other cases. I've chosen three cases that are all very different, including one that's quite challenging. I think it's the therapist in me always loves to look at more challenging cases and see how we could respond to those. So yeah, let's look. So we're just going to look at a multi-baseline example where the therapy was administered at different points in time after the psychedelic. But also just to frame this, so we do, I mean, the population or the group that we were working with, generally they weren't a clinical sample. We did use a depression and anxiety measure, which had a significant overall effect size. We do the normal kind of groups statistics on it. But a big thrust of the study has been to understand the nuances of what to do with different cases, as well as having group level data. So there was a statistically significant effect size, but not between from retreat to post-integration, post-therapeutic integration. So this, don't worry if you can't read this. If I just zoom out, just looking at the overall shapes, here we've got this nice kind of afterglow shape. So a person's psychological flexibility increases, then it fades. Same here, increases, then it fades. So in this cohort, with quite a number of people, the therapy didn't start until the natural afterglow seemed to be fading. One person reported they thought it was really useful to have it start, with the integration therapy start around this time when you're still quite fairly, the retreat wasn't very long ago, but the barriers are coming, are emerging. And perhaps one of my favorite ACT mantras, in a way, if I can call it a mantra, I like to think of it as a mantra because it's such a useful concept, is I think therapy so much is about bringing the barriers into the work. I should have written this on a big slide. Bring the barriers into the work. So we're kind of looking for barriers because that's how we grow. So as soon as they start to emerge after the psychedelic, we want to treat them with some kind of therapeutic intervention. So what we can see here, so in this one we had a less clear, like we still had a jump in psychological flexibility during the psilocybin, and but then barriers start to emerge, and then not long after the therapy, it seems to stabilize. The psychological flexibility, according to these measures, seems to be stabilizing. So yeah, that is pretty much all I wanted to show you on this slide. I'll show you some. This is another example of, in the qualitative data, someone saying that switching between different cells and that kind of experiential exercise was particularly helpful. So yeah, before I start rushing again, I'm just looking at my watch. So we have about half an hour left. So that's good. I think I can kind of relax a bit. So further developing a contextual behavioral science informed psychedelic therapy. So these are just some ideas or things that we've been trying out with, in different cases as this has been evolving through a number of different cohorts. We've had 4 cohorts now, and this is just a preliminary review. We're still, we have so much data. We're still working our way through it. This is a preliminary view of some of the themes that seem to be emerging from, I think, the 3rd cohort. I think it was. I think this is just the 3rd cohort. So I've already touched on a few of these things. So yeah, I think we've already covered it in some detail, that psychedelics and integration going hand in hand. One continues the next, so people already saw them as separate processes. One really built on the other. So then, yeah, the same emotions continuing to emerge. The openness to emotion seems to transfer into the integration therapy. Seem to be able to re-access that openness. So it really does seem to be, I like to think of it like turbocharging the therapy when you have recently had a psychedelic experience. It looks like that diagram I was just, that multi-baseline, the last slide, with the, it really looks like the afterglow can be probably extended, at least in terms of that measure of psychological flexibility. I've already talked a lot about this perspective switching kind of technique. It's like combining perspective taking with cognitive diffusion. Parts work, yeah, people found that very helpful. I think IFS is expanding a lot in the world at the moment. A lot of people are finding it very, very helpful, and it actually fits with the ACT principles of noticing different selves and different voices telling you to do certain things and changing your relationship with those. But I think IFS can give a little bit of extra depth of noticing what is the motivation of these different voices, what do they really want. And it helps bring compassion, it adds compassion to, makes compassion more explicit. I think acceptance and commitment therapy has, ACT does embody compassion, but it doesn't explicitly point to it so much, which is something some people have criticized it for. So just making it that little bit more explicit, I think, has been helpful. So yeah, this is something that in the fourth cohort we did a lot more of to explore what this is like. I'll just read this one out. What I learned, so it's using repetitive exercises not only for diffusion and perspective shifting, but also for connecting with the returning to the psychedelic experience itself. You might remember I mentioned the return during the integration phase when I was first presenting the different 3 phases of psychedelic therapy. So what I learned was that there was a way to re-experience the trip in such a way that it's available to me every day. So this is a very powerful effect. I really felt the emotions that were related to this. They weren't as strong, but they went in that direction. So this was a very, very useful thing. This is about starting to use kind of a repetitive review. It's influenced by an approach that I mentioned before, the TIR approach for trauma. One of my favorite definitions for trauma is simply abnormal experience. I've worked with trauma a lot, and we get traumatized when we have experiences that just don't really fit with our view of the world. That's usually a negative experience. But any experience that is very different and very intense doesn't have to make you feel upset, but it's something to process, it's something to integrate. So a kind of trauma processing technique for integration seemed to be appropriate. So that's something that we've sorry, I got distracted by reading the messages again. I hope you're all still able to follow me. Yeah. So reviewing a repetitive imaginal review, so a couple of the experience seems to be helpful. And yeah, looking at things, we're going to look a little bit more about doing reinforcement. So how do we change behavior? Reinforcement is a very important part of that. So looking at things on a more systemic level, and I'm about to show you an example of that. So what's reinforcing the new behaviors? In a way, the bigger the change, the more barriers in a person's life might come to try and push you back to your old ways. So of course, when you return from a psychedelic ceremony, you may feel very different, but the world you return to is probably just the same, and you might have colleagues or even friends who don't understand what psychedelic experience is. They might roll their eyes when you mention it. So there are lots of systemic barriers. So I think with bigger behavior change, I think we probably need to get systemic. So that's something that we've also been researching and collecting data on. So we're going to look at 2 more case studies. So this is somebody who we knew had complex trauma before she started. This is Sally, just self-described as hypervigilant and overcritical, already seeing a trauma therapist, although I think a somatic experiencing or a somatic therapist, but to not have 2 therapists at the same time, that was temporarily stopped so she could engage in this psychedelic therapy. So again, this is the preparation phase. So psychological flexibility baseline is probably around here, and then I think this is really important too. remember my favorite mantra of bringing the barriers into the work? Well, that's kind of relevant throughout the process. Definitely during the psychedelic process, barriers can emerge. And sometimes a person might struggle to face them, or they don't understand that the horrible thing is where they need to go. Again, it's another big emphasis of acceptance and commitment therapy. Those of you who are familiar with, some of you I'm sure are probably ACT therapists. And then you can see after facing something that was very difficult, some really difficult childhood memories, then psychological flexibility much higher. This purple line is negative emotion. Then all these emotions. So so this is an example of being able to do complex trauma work in the context of psychedelic therapy, where this participant was ready to start processing the trauma as it came up. So again, more arguments with husbands and stuff, going into lockdown and being closely confined with people. But of course, these things, affect our relationships. So in this cohort, we did quite a lot of this. There's two therapists. I was one of the therapists, and my colleague Robert Krause was the other therapist, and we were both trying this out of first doing an imaginal repetitive exposure of the actual psychedelic ceremony. So all the stuff coming up. This was an example of the music. She said the music like a horror film, how so sad music or dark music can help a person access the more fearful feelings, because it can be a temptation just to go into, a person can just have very positive experiences, which can be definitely healing as well. But it's likely that, especially if you have complex trauma, you probably will need to look at that trauma at some point. So I guess especially in an intervention that's fairly short, just 4 sessions, you probably want to focus on that pretty soon. So she re-experiences, so it's a bit like almost, it really brings back intensely the feelings of both positive and negative, even especially positive actually, of the psychedelic ceremony. So what we basically have here is 3 whole sessions. They were longer sessions too. So these aren't 50-minute sessions. They're probably 19 minutes to 120 minutes of doing very intense imaginal exposure. Another thing that I found that impressed me is in this, what this participant was able to do, or also I think was really helped by the psilocybin experience, was there's a kind of trauma, complex trauma is trickier, of course, because it's not just, oh, I had this terrible thing that happened on a certain time that lasted for 1 day, and that's what it is, and that's what I'm traumatized by. Complex trauma, of course, is the opposite to that. So when you have years of experiences that were very, very challenging, so it really becomes part of how you are and how you see the world. And so she was able to scan through a whole 7-year period of long-term childhood sexual abuse, and her ability to do that was, having been opened up by the ceremony, it was just really something. It was really moving to witness. And being able to process that, because the thing again, we can understand behaviorally. We can think of it in terms of extinguishing certain behavioral responses when certain memories or certain contexts are there. And a 3rd session, so we kind of narrowed into more specific incidents, starting broadly and zooming in. So this was just like turbocharged trauma work, and reaching points where, again, she's transcending the memories. She's seeing them with from new perspectives, the stepping out kind of process again. Again, just from this repetitive process, but like, it's almost as simple as repeating a thought that's, apart from it's a whole very intense experience. I remember, where the person can even feel like they're regressing. I remember again in this example, during the ceremony, she felt she regressed to being the age 5. And then insights how she sacrificed herself to fit in, and stubbornness can serve her. Insight is an important part of the process. And then, yeah, maybe I'll jump to, I think we've got plenty of time actually, yeah, maybe I don't have to rush. So this is like the second part of the model. You'll remember this, these spectrum of selves. Somewhere up there you'd have like a transcendent self too, but I think for daily living, we're more in this kind of compassionate, I'm here now, more mindful self is kind of probably what we're aiming for, though informed by more transcendental, more mystical experiences. So this is a way of just tracking the process of new perspectives, so more compassionate perspectives, in these four different areas of life. So you have self-care, relationships, community, environment. Notice that these are all concentric as well. Relationships contain self-care, contain you, community contains relationships. That's all contained by the environment. The environment can refer to both your immediate environment as well as the natural environment. So this has to travel through your mind where there are certain barriers will surface, like we've seen already in a couple of, in that first case study, I thought can come along even not long after the psychedelic experience, that you're not worthy, or you're, there's some reason why you can't just do what you want to do. And yeah, in this case, of course, I already mentioned the trauma. So the self as traumatized was very much there, and memories, the thought, memories and fears of the years of childhood abuse, and behaviors that, of course, when we're traumatized, we have particular behaviors, and when we're being more expanded and opened up and compassionate. But what's also this is applying is this multi-level kind of application I mentioned when I was defining what is contextual behavioral science. I'll try and it's a fairly big subject. I was trying to sum it up, but especially in recent years, some emphasis on the evolutionary perspective. So maybe you'll hear something of this from David Sloan Wilson. Sometimes he talks about multi-level selection theory, of how even in biology. For example, what certain cells of your body, say in a multi-celled organism, individual cells choose to do things or engage in things that serve the next level of, say, being a multi-celled organism. And then me as one individual human, I might do something that isn't just about what I want, but maybe it's what the group of humans wants, or eventually maybe even what could make our living on this planet more sustainable. So we live in these times of climate tragedy and mass extinctions and things like that. But of course, I'm not saying everybody has to be focusing on that. We all have, we all have our own, we can just make choices. We can make choices for our relationships rather than a choice just for ourselves. So in looking at this box, and yeah, I guess you can't, this might be difficult for you to read. I don't know if I can zoom in on this more. This says meditation. This is in self-care. You can read self-care, I'm sure. And meditation, it can serve multiple things. So I quite like the concept of multiple function. So behaviors, of course, can feed back to maintaining new perspectives, because part of the fear in psychedelic therapy is that we might we just might drift back to our old, more critical ways, and that definitely happens. But if during the afterglow we can set up a whole new behaviors, and even change our context, changing our context of how we live, the environment that we're in. To if I put a yoga mat on my bedroom floor and leave it there, maybe that would help me meditate more, perhaps. So we can look at things, how it's a feedback loop. And how that can reinforce new behaviors. But also on this multi-level, I can look at what I'm doing here. Maybe my meditation, it's not only about being more present so I can be more compassionate towards myself. Maybe it's also can help me have more open discussions with my husband, engage in relational therapy. Maybe can help me keep on focusing on what I want to do with the community, finding like-minded people who are interested in similar things. Another thing that's highlighted here is a thing that's emerged in quite a few cases is how you can have a value that you have values that are common to all of the different levels of these different domains of life. So authenticity, breaking the mold. There were quite a few actually. I couldn't fit them all in. It says authenticity, breaking the mold. I don't know if you can read that. And how that can inform behaviors throughout all these different areas of life, and having a coherence also with this kind of model. If sometimes you might have an unsupportive environment, or you might be trying to do too many things, but if you can just see how it all slots together and see if all these different layers are in harmony with each other, so that what you're doing here, it connects with what you want to do long term, and just framing it that way, then that's a way of bringing greater coherence. So yeah, sorry if you won't let me zoom, sadly. But yeah, these all say authenticity, breaking the mold. This is meditating. This is discussions with husband. This is finding like-minded people. This is growing vegetables. And of course, this interacts with the outside world. So it's seeing how all that slots together. So that's a multi-level way of looking at that's the multi-level way of reinforcing behavior. And yeah, so this again, something from one of the independent interviews, seeing again more data on how these two things slot together. Without this psychedelic experience, so this is back to remember this is a complex trauma case. Without this psychedelic experience, I wouldn't have been able to go as deep as I did. So I definitely think that there's something fundamental about that particular, I think that's a typo there, sorry about that. If I had to strip that out and only do the therapy, I don't think I would have achieved what I've achieved. And had I done the mushroom retreat and not had the integration therapy, I think something would have been lost. So again, it's just a great example of how these two things slot together so well, and we can apply it to very precise things like trauma, specific traumatic memories that surface. So I believe we have 12 minutes left. And so just jumping, this is a particularly challenging case, severe depression, burnout, someone who hadn't been working for a while, again on the DAS, scored with extremely severe depression, a score of 30 on the depression subscale, and definitely progress was made, but it was much harder going, let's say. So this is someone who'd actually, I think he had taken psychedelics at a low dose once, not completely psychedelic naive, been off work for a long time, paralyzed by indecision about relationship, the partner. So again, we've got a baseline of psychological flexibility around 150 or so. Then shoots up during the psychedelic ceremony. And then it looks like we do have actually, according to this data, it looks like stabilizing at perhaps a higher level of psychological flexibility. But this was quite a challenging case. And one thing that really stood out about it was it's an example of you doing an intervention during this phase, the second phase, during the actual psychedelic ingestion phase, where the person, he was very, very, very stuck and very worried that it wouldn't work for him. And no matter what we initially, no matter what people offered to him to try and help him just trust and let go, and it wasn't working for him. So what we ended up trying was a kind of a cognitive diffusion. You could call it a cognitive diffusion technique, but it seems that a lot of what his behaviors, he was trying to block me. I was there, and he really wanted to be helped. I was very much asked to try and intervene in some way, but whatever I suggested, he was saying, I know that, I've read all the ACT books, I know everything, I know everything you're doing, but it can't work for me, it can't work for me. And as we talked about it a bit more, what emerged was that he had this feeling this, he had this some idea or sense that he was a truly defective person. He used more explicit language than that, there was something really, really wrong with him. And so I managed to kind of, what's an interesting question is, what can you actually do during when a person has taken a high dose of a psychedelic? It seems to me what's emerging as the answer is that things that are very, very simple, but very targeted can work very well. And this is one example of that. So I had him finally, I managed to have him humor me and finally engaged him in the exercise of just repeating over and over again, I'm truly defective. That's the paraphrasing what he was saying. And then I would just say it again. I would just say, thank you, say it again, thank you. And so he was repeating it over and over again. And it wasn't really, I guess, in behavioral science, we're always thinking about why are we doing what we're doing. And in a way, I wasn't trying to diffuse him. What I was trying to do actually was more like willingness. I was trying to get him to connect with what was there. So again, something a trick I learned from my trauma therapy background. When a person can't access a traumatic memory, but it's clearly there, by having them repeat a certain element of it, maybe a feeling from it, they managed to connect with it. So then he went deep, the emotion finally came up and he managed to go properly on his journey. It probably took about 20 minutes. And then he was just off on his journey and he went into a more accepting place and just allowed what needed to come up to come. So that was the psychedelic ceremony. And then during the integration therapy sessions, again, we did a lot of imaginal exposure and basically, started to do trauma work again. So seeing how this connects with trauma work, I think is really interesting because psychedelics enable what is often people find difficult to access. Suddenly it's accessible, and doing kind of quite heavy duty imaginal exposure kind of exercises can work really well. So yeah, he re-experienced the actual therapy sessions. Sorry, he re-experienced the psychedelic sessions just imaginally. And it was very interesting to see how that could open up his mind. It's like I could see his psychological flexibility expanding there and then, when it's like lockdown, no, the critic's very much in charge. And then through re-experiencing it, he would come out of it, but then quite often go back into it again, almost within a minute, maybe 2 minutes later, he was already going back into it, and I could see that happening in the session. And so yeah, and eventually it connected, this feeling defective, it connected with having had years of being told that, kind of being treated that way by his father. So memories coming up. His father is screaming, he's shaking, and having experienced that for many years. And so yeah, this was tricky. I can't say this is this wasn't like just one super amazing success story. It was, but I think we could learn a lot from it. Yeah, here in the qualitative data, he's talking about what was helpful, and this thing of re-experiencing multiple times. So that so he moving. So what starts off more like a more surface memory moves from just describing it to actually feeling it. We found that to actually feeling it. So again, it's one of the mantras of the plant medicine world: feeling is healing. So how do we enable ourselves to just feel what's difficult to feel because we don't want to feel it? So your psychedelics can really help with that, and of course that can help behavior change. We're coming towards the end of the presentation. Am I rushing too much? I've got 5 minutes left because I could potentially say more about this, but yeah, according to I mean, in other follow-up data, he's been sharing things about how he can often, even though he's more engaged and he's gone back to work, he can still feel, oh, maybe it didn't make a difference. There's that very strong voice that wants to sabotage everything and say nothing worked and everything is bad, even though there definitely has been behavior change. So I think that's another interesting example of behavior change, that a person can clearly change their behavior and be aware, even when they think about it, that they have changed their behavior. And yet the mind, the old mental patterns can still return and still sound very convincing. even wanting to say that the progress wasn't really made. So I'm just going to give you, this is just a brief overview of the, you'll remember that we've been analyzing all these squiggly lines, trying to understand how how relationships between these different factors. So we've got, I'm sorry you can't read this, but I can read it out to you. This says personality getting in the way, life satisfaction, psychological flexibility is the aggregate of three of these lines, the one up here. So we can zoom out to group data, because as well as being able to understand what's happening with individual cases, we can zoom out to group data. And this black line here is the pathway I was pointing out before. So yeah, the behaviorists will like this. It does look like, at least through the lens of this measure, of course every measure is also a lens. We're always looking at, perhaps we're always looking at, maybe, who knows, we have a philosophical debate about that, but certainly most of the time we're looking through some kind of lens of our experience, and a psychological measure, a psychometric measure is definitely a lens too. So it looks like it starts with progressing. This is, I have two subgroups where the green lines are when between 50% and 75% followed a certain pattern. So we've got two different subgroups, but we have this very clear pattern of progressing, leading to more awareness and openness, and being able to feel a negative emotion more, which makes the person more aware of personality getting in the way. These dotted lines over here in one of the subgroups, this is when there's a day delay. We're looking at a type of causality, grandeur causality, when one thing predicts the next. That's one way of understanding causality in terms of predicting how well something predicts another. So over here we have a satisfaction increases. It means next day the openness is likely to increase. So then as that openness increases, maybe that can plug into this other, the black pathway here. So yeah, that was with, that's with nearly 1,000 data points. That we had 16 so far. I think we've had 16 people where we had enough data points, because each person needs around 60 data points. Some people we have a lot more than that. So yeah, just a brief summary. So I mean, this is all very preliminary. I can't really make any grand scientific claims, but there's certainly clearly some patterns emerging that we can continue to research. So things that, so just briefly to an overview, these kind of cognitive diffusion and repetitive perspective shifting exercises seem to be helpful in all three phases, or well, in there aren't many cases where we've tried it during the actual psychedelic experience, but at least it does seem that I'm pretty convinced intuitively, at least, that when it's something very simple, like perhaps just one instruction, like just think that thought or feel that feeling, if you can operationalize that into one very simple repetitive exercise, then when a person is stuck or there's something that they're struggling to open up to, then that can be really helpful. So the capacity, what also seems to be emerging, is this capacity for imaginal exposure, facing difficult memories, seems to be enhanced after psilocybin. Yeah, many people have described the compassion and IFS aspect of self-work really, really helpful. So from an ACT point of view, that's expanding the self as content work. When our self-story work, when we have an idea about who we are. Psychological flexibility does, there's quite a lot of graphs where the psychological flexibility clearly increases after the ingestion of psilocybin, and it can probably be extended with processes that align. So the thing I love about ACT is we're not trying to start a new brand of therapy. We are in contextual behavioral science. We're trying to transcend different brands of therapy, and we're just looking at things on the level of process, which of course can be active in many therapies, not just acceptance and commitment therapy. So please don't think I'm here to just wave the flag for acceptance and commitment therapy. Then, yeah. So it seems to be possible to re-evoke the mental states from the psychedelic experience during the integration using imaginal exposure. And yeah, the final point from those group graphs, statistically significant group effects have been found for change starting with taking action. So perhaps a way of understanding what we've been looking at here today is that, yeah, psychedelics can really, I know in other parts of psychedelic literature, people refer to increase in agency. It's the words that have been used in academic papers, I think. So a person is just more present, they want to do stuff. It's very common to maybe declutter your house or something. It boosts your willingness to engage and do things, and that is very helpful for behavior change. And I think there's another point here. So yeah, so a little metaphor I thought of for this, it's a bit like psychedelics, like some kind of oil, or metaphorical oil for increasing behavior change. But another point I do like to emphasize, that as you can see, we're researching that big grid of multi-level reinforcement through self-care and relationships, also feeding back to behavior that helps you stay in a more selfless process, a more present self, and even also visiting these more transcendental, mystical states. So I think that's everything. I've gone over 2 minutes, but I'll leave it at that. So Niall, are you coming back?
Hi, Henry. That was a fantastic presentation. Thank you very much for sharing that wealth of knowledge that you've built up with us. Really appreciate it. We're getting some great feedback on it as well, and we've had quite a few questions too. So I'm just going to ask you some of these now. So the first thing I want to ask actually is, are there any populations that should not take psychedelics? Like, are there any high risk groups that you would recommend that avoid taking psychedelics?
Definitely. I did speak directly to that. I gave the example of people with suicidal tendencies, but of course in clinical psychology there's lots of ways of trying to define that better. Of course, in studies, especially people who might be prone to psychosis, even if you've had psychosis in the family, are examples of it bringing on psychosis if a person is, and I think it brings up what's there. So there are definitely people who I think are too vulnerable. I don't know if you want me to try and say more detail about that, but personality access to kind of stuff, or personality disorders. Yeah. So if a person has very challenging psychological problems or psychiatric problems, then maybe not. But like I say, I'm an optimist, so hopefully more and more people will be able to help as more research is done.
So you said there that it brings up more of what's already there, and then that says to me that a big part of this is, on a different level, a big part of this comes down to the intention that a person brings to a psychedelic experience. Like, how important is that? And how would you recommend someone to work with intention when they're going into a psychedelic experience?
Yeah, well, what we do on the retreats that we've been running, and it's fairly standard, is you can have a person journal, explore certain questions about what's important to them. Yeah, from an ACT point of view, you're going to be looking at what are your barriers, what do you get stuck in, what's important to you, what do you long for, are any unlived values. So that's a certain amount of preparation you can do. I think I also feel like I should add that you never know what's going to come up. So a person can go in with a certain intention and something completely different surfaces. I think it's just good to go in with that very open attitude, and being aware that you probably have fears that you will want to face. So being ready for those. So if you have a good idea of what those fears might be, then that's helpful. But at the same time, it is about just trusting in the process.
Cool. And I'd be curious to ask, and you don't have to answer this if you don't want to, but just what effect have if you've had psychedelic experiences in your own life, what effect have they had on you, and have they changed you in any way?
Yeah, I think they have. Well, but like what I was saying about psychedelics turbocharging things, I've spent my life studying mindfulness-informed approaches and therapy methods and working with therapy clients, and so it's definitely changed how I do therapy actually, because I have a deeper personal understanding of what it is to be willing to experience something that's really horrible. Even though it's funny how these things have so many different layers to them. So even though it was already my job and to do that, and I worked as a trauma therapist and all about facing scary, horrible memories, and it still gave me a much deeper, real sense of what is that? What is it to really embrace your demons? So it's enabled me to do that in my life, and enabled me to see my own self stories much more clearly.
Fantastic. Okay, and in terms of a time frame, when psychedelics are going to become more commonly used in psychotherapy, and this is going to become, I suppose, more widely used and more popular, what are your thoughts on that? Like, do you see this becoming more widely used in the next few years, in the next decade? Like, do you think it's going to be a long time, a short time? What do you think there?
Yeah, there's different answers to that question. There's different aspects to it. There's the medically licensed official interventions that the NHS might even access. That will probably take, it's hard to predict, but certainly a good few more years, maybe 4 years or something, 4 or 5 years, people estimate. Well, the one that's going to come up first is probably MDMA for depression, so that one might be sooner. I think they were hoping to. Of course, these things tend to get pushed back, but that's the one that will probably become available maybe in 2 years. I don't know. I'm guessing, but yeah, it's not a lot of years. It's not 10 years, but maybe 2 years. I don't know the exact latest on that. I could also mention things like ketamine clinics. Ketamine also has a psychedelic effect. It acts on a different part of the brain, but also gives people that kind of psychedelic experience. And that's already available. There's a clinic in Oxford. There's a new one that's just opened in Bristol in this country even. And then already right now there are retreat centers in countries where it's legal, where people can visit. Like, yeah, someone was asking in the chat if it's legal. Yeah, the retreats that we run in Holland, there's quite a few retreat centers where it's legal to do it. So it's emerging in that way. Yeah.
Very interesting. You mentioned the MDMA therapy there. If anybody's interested in sort of seeing a documentary about this and how this is actually used in therapy, there's a really good one called Trip of Compassion, and it basically shows how MDMA can be used to treat trauma. It's fascinating. So we'll link to that in the resources after these episodes, or after this session. We've got a question here from Meryl. Meryl asks, is it a case of going to traditional therapy and seeing how that goes, and then introducing psychedelics when the person needs assistance to go deeper, or do you recommend it being used from the beginning?
If you're going to find a way to do that legally, I wouldn't want to recommend anybody who does anything illegal, of course. There are countries where you can do that, or you can travel. Probably definitely do it. You want to have. It's great if you already have a strong therapeutic relationship with somebody before you start. That's another thing that came out of our qualitative data. Actually, a lot of the people on our retreat, they really appreciated. This is a slightly different point, but they really appreciated having a therapist who was actually there at the retreat, because you could really hit the ground running. That did just feel like a continuation. So if you started, so definitely, yeah, there are harm reduction psychedelic therapists who, yeah, if you found a way to access a psychedelic retreat of some kind, then they would prepare you. You do preparation work with them first. Remember, there are 3 phases. And then you would, of course, return to them after you'd had your psychedelic ceremony, assuming that it wasn't possible or legal for them to be there. But hopefully you'll find a legal way of doing it.
Yeah, okay. Zoe asks, is there a license to obtain to use psychedelics in therapy? And how do you know who will react well versus those who are going to have a negative experience with psychedelics in therapy?
Yeah, well, it's it's a process of screening people, interviewing people, looking. There's lots of questions you can ask people about their history, of if there's been any kind of history of psychosis, that kind of thing. But having said that, so we are, especially in the research world, we're very careful about that. We're a bit paranoid even, because we're worried that if it could slow down the research or even stop the research if there were some disastrous examples of someone, say, committing suicide after an experience or something like that. But having said that, so we do want to be very, very careful. Having said that, I mean, on the studies, there haven't, as far as I'm aware, there haven't really been any cases of anything. I mean, people have had things like psychotic episodes, but of course they're temporary and they go back to being normal. Or you want to give people a lot of psychological support. I was presenting these cases of combining with trauma therapy. So even if the psychedelic experience was traumatic, they'd be straight into trauma therapy immediately afterwards, and they will probably get some therapeutic gain from that.
Brilliant. So the next question here is from Katie, and Katie asks, could you say more about the difference between doses? Would it make sense for a nervous newbie like her to start out with a low dose for the first time and then work her way up to a therapeutic dose eventually?
Yeah, absolutely. I was about to speak to that as well. Yeah, it was kind of relevant to the previous question too, wasn't it? So yeah, once you screen the best you can, and yeah, you can just start with a low dose. It's a bit like, sometimes I think of it like, until you're in that situation, it's a very different situation, it's a very different experience. Until you're there, you don't know how anybody's going to react. It is a bit unpredictable. We know that most people are totally fine, especially if it's extremely important they're in a very safe environment and the person feels really, really looked after. Because if a person was in a very unsafe environment, they took a psychedelic, it could just be a terrible traumatic experience. In a way, it would intensify how traumatic. Say you were being attacked in a dark alleyway, very unfortunately, and you happen to be on a psychedelic, then it would probably traumatize you. Maybe that would traumatize you even more than if you were attacked on a dark alleyway without a psychedelic. That's just to kind of give you an example of how it just amplifies your sensitivity to everything.
Yeah.
So yeah, definitely start with low dose. And then gradually build up.
The next one's from Anna, and Anna asks, can you say more about how this works in practice and research? How are clients invited to include psychedelics as part of their support? What is their experience of this, their expectations and concerns? Is it legal, or has this just been looked at in research so far? Also, I'm interested in what the risks and disadvantages for people might be, and what behavior change outcomes have been looked at. In other words, specific behaviors rather than depression, stress, etc. So there's maybe like 6 questions in there. I'll let you tackle whichever ones you feel most relevant to tackle are.
Who's that question from? I'm going to see if I can find it so I can see the list of questions. Is it near the top?
It's quite early on. It was from Anna, yeah.
Let's see if I can find it. But well, yeah, I think I already did speak to the risks a bit. There is a risk a person could bring on psychosis. Someone who's, I think it's like, it's possible that if a person's prone to psychosis but they've never had a psychedelic experience or episode yet, it's possible it could bring that on. There is some risk of that. So we really try to screen that out. But we know certainly the vast majority of people, majority of people are fine.
And how do you screen for that?
There's different ways. It tends to be done with clinical opinion. There are longer interviews of symptom checklists. It tends to be done by clinical opinion, where you interview people and you can see how they respond to certain therapeutic interventions sometimes, see what their relationship with difficult emotion is like. But yeah, it's not a completely exact science of screening. It is done on clinical opinion. Yeah, examples of specific behavior change. Well, yeah, I was going through some of those in this presentation. Maybe I already spoke to that quite a lot. There are many examples of being kinder to each other, people being more compassionate. If you want a more positive side of the coin. But yeah, I think I've already spoken to that quite a lot.
Yeah, for sure. The next one's from Anahita. So she asked, how do you feel about the use of consciousness raising technologies such as meaning-driven VR experiences as another form of self-transcendent intervention, and also about having a range of self-transcendent interventions from mild to strong? So I suppose she means using psychedelics in conjunction with other technologies like VR and things like that.
Yeah, I think it's really interesting. I mean, VR alone, anything that gives you a very immersive experience, a more experiential experience. I think that's one of the big dichotomies in what's therapeutic. What's just on the level of the head, where it's just some information that you don't really connect with, and what's a very embodied, intense experience. Perhaps the other, the opposite is just thinking a few numbers. That's the most abstract kind of intellectual kind of example. The opposite end of the scale is being regressed into believing you actually are in another situation in the past. When, say, you're regressed into a 5-year-old, it's an extremely experiential process. So VR, of course, is just another way of giving an immersive experience where you feel like you are somewhere else in a certain situation, doing something. So I can see how that could be really therapeutic. And I think there are some people looking at combining them with psychedelics. I think they call it moist media, where maybe it's a low dose of psychedelics to intensify how you connect with the VR. And then, yeah, I know that they've used VR for psychosis, making an avatar of, perhaps, I'm not totally sure, but yeah, I assume the avatar might be the person that's telling you negative thoughts during an episode of psychosis, relating to those thoughts differently. I think that's something that people have been working on.
Very cool. Did you say moist media?
Yeah, I think it's called moist media. So the idea of having a whole scale, I mean, I love scales, as maybe you might have guessed from this presentation. So having a scale of different transcendental options, I think it sounds great. It sounds great to me. I think you can be more calibrated when you have a scale. And it's all about being context sensitive and finding an intervention that fits with that particular person's experience the best. So if you have a range of different transcendental possibilities, transcendental offerings, then that's great.
Yeah, that'd be incredible if you could go somewhere in the future, like a center, and then you would have like an initial conversation with someone, and then they would choose the self-transcendent intervention that was best suited to your context and your situation. That'd be really cool. So Anthony asks, do the psychedelic assistive therapists and practitioners have a shared view of what a mystical experience is? For example, is it spiritual beyond self or some creative aspect of brain function?
Yeah, there are some really interesting measures. So, in psychology, we try to find more objective ways of measuring things with self-report questionnaires. Self-report questionnaires definitely have their issues, but there's something called the mystical experience questionnaire, which has items in it like all notions of myself was dissolving away, or actually that might be the ego dissolution inventory. There's another one called the ego dissolution inventory. I might be mixing them up. So there's like oceanic boundlessness. So there's lots of experiences. So these measures I think they've been tested pretty well. They've been tried out on thousands of people on online surveys and stuff like that to narrow them down to I think when you have a mystical experience questionnaire, I think it has 30 items, but it's probably been narrowed down. It might be a shorter one by now, but I'm not totally sure about that. That's what tends to happen with these psychometric questionnaires. I think ego dissolution inventory, I think that's just 10 items, yeah. And I might be mixing it up anyway. Yeah, so in terms of psychometrics, there are ways of measuring it that I think are pretty good. In terms of neuroscience, there's definitely notable parts of the brain that switch on and switch off or interconnect during such transcendental experiences. That's something that the neuroscientists have been studying. But yeah, I'm not a neuroscientist, but I do, and I do kind of watch that space a little with some interest. I think there's a prefrontal medial cortex or something that relates to self-story. I'm forgetting all of, yeah, I'm not a neuroscientist, so maybe I should not comment on that, but there's different specific parts of the brain that relate to such things, such as self-story and transcendent states. That's measurable with neuroscience.
Brilliant. Okay, well, Henry, that's all we've got time for today. It's been absolutely brilliant to have you with us. Before you go, is there any final things you would recommend people to check out online, or any recommendations? Or I know your website, it's psychflex.co.uk, is that right?
Yeah, that's right.
Is there anywhere you'd recommend people to go or things to check out?
There's so much happening in the psychedelic space. Yeah, there are conferences. If you're interested in psychedelics, there's going to be a conference in Germany in September, the Insight Conference by the Mind Foundation. That might be something to check out. It's one that I think is actually happening this year. That's I think actually going to happen in person, partly at least. Wow. So that's something that you could look into. And yeah, we're hoping to run these ACT-informed retreats. We're hoping to run one in next month, but it's a bit, we haven't decided if the travel restrictions will allow it. So we're waiting to see what the travel restrictions will be. So that's something people could potentially check out. But yeah, yeah, in the UK, there's the Psychedelic Society, which has events all the time. There's so much happening, but yeah, there's the main things I can think of right now off the top of my head.
Cool, and I think there's something called Breaking Convention as well.
Yeah, that's every 2 years though, so I've got a feeling that's not this year. I think it was last, no, actually it was 2019, so maybe it is going to be this year. So yeah, it's every 2 years, Breaking Convention, which is a really nice event too.
Cool, cool. Well, Henry, thanks again. It's been great to have you. And everybody else, we're back at 1 o'clock for a talk on using evolutionary science to change behavior from David Sloan Wilson. So thanks for tuning in, and I'll see you guys all then. Thanks, Henry. See you later.
Well, thanks everybody. Bye for now.